For these basic lessons, your patient's incision should run from left to right in front of you. Think spay and how a patient is placed on the surgery table. Remember, you will not be able to move your patient during the lesson since you cannot move your patient on the surgery table. Tissue forceps will be held in your left hand using a pencil grip. Needle holders will be held in your right hand with your thumb and ring fingers in the finger rings. Your pointer finger will be extended forward, and this is to help stabilize your needle holders as you push your needle through the tissue. The tips of your needle holders will be used to grasp your needle about 2/3 down the length of the needle on its body. The needle and the needle holders should be roughly perpendicular to each other. Some terminology that you're going to hear. A bite refers to the action of placing a needle through the desired layers of skin or tissue. That is a bite. A throw is the act of lining up your needle holders, wrapping your suture around your needle holders, grasping the tail, and pulling it through the loop. A knot consists of 2 throws. So one throw, your second throw, wrap it around once, grasp the tail, and pull it through. You now have 1 knot. You will hear us refer to a special knot called a surgeon's knot. This one begins the same way as your regular knot. You take a bite, I'm going to move this over so you can see a little better. Line your needle holders up along the incision, wrap around once. This is where this would be a regular knot because you would reach over and grab your tail. A surgeon's knot has a surgeon's throw. So you wrap around once, you wrap around twice. Now you grab your tail just like you did before and pull it through. Remember, you need to make a knot, so you have your first throw. Your second throw is only a single wrap. Grab the tail and pull it through. You now have a surgeon's knot. To make a secure knot, you would place a surgeon's knot or surgeon's throw, a second throw for your first knot, a third throw, a fourth throw, so you would have 2 knots. All right, let's move on to making a simple interrupted suture. You're going to take your first bite, starting opposite you along the incision and coming out on the opposite side of your incision near you. So enter far, come out near. You're going to line your needle holders up along the incision, and we're making a surgeon's throw. 1, 2, grab your tail, pull it towards you, line your needle holders up. Remember, we're making a knot, so you need 2 throws. So a single wrap or a regular throw, pull it through. You have 1 knot. You need your second knot. Hold your needle holders along the incision, wrap once, grab your tail and pull through. Hover it, wrap once, and pull through. You're going to make your tails about 5 millimeters long. So, to review, you did a surgeon's throw, a regular throw, a regular throw, and a regular throw. So let's demonstrate that one more time. Normally, you would place your sutures so that your entrance and exit points are equal distance on either side of the incision, and your second suture would be equal distance along your incision. I'm going to make mine a little wider so that you're able to see what I'm doing a little easier. If this were on a patient, I would be placing these closer together. So take your bite, okay, line your needle holders up, surgeon's throw, pull together, line it up, regular throw, so that's 2 throws, equals 1 knot, line it up, next throw, line it up, this will be your 4th throw, or the end of your 2nd knot. Cut your tails. Okay, let's do that one more time. Take a bite. Your holes are opposite each other. Surgeon's throw, 1, 2, grab your tail. If you notice, when I pull it through, my needle holder is now closer to me. Hover my needle holders. Regular throw. Hover my needle holders. That was 1 knot. Here's your 2nd knot. Your next throw. The 2nd knot, or 2nd throw of the 2nd knot. Right there. Okay, let me point out another aspect right now. When you cinch down your initial knot, you want to make sure that these are loose enough that you can fit a hemostat, or in my case a pair of scissors, underneath. You never want to pull your incision so tight that this puckers. Okay? So I'm going to place one more. You're going to take a bite. Bring it a little closer there. Okay, take a bite, hover your needle holders, do a surgeon's throw, grab your tail. Now you'll also notice that when I pull it through, this makes a nice little line here. If you ever wind up with something that looks kind of buggery like this, you're making a granny knot. That's not good. It's incorrect. So you want to make sure that it makes a nice straight line. You might notice a little swirl effect to your knot area, which you may not be able to appreciate on this video. So your surgeon's throw, your 2nd throw, you now have 1 knot, your 3rd throw, your 4th throw, and you now have a 2nd knot. Cut your tails about 5 millimeters, and you can see how you now have a simple interrupted suture pattern.